get started
Sure.
because I don't want to take time away from Christina or anybody else here that has questions. So first of all, let me say today is December 18th. This is a monthly forum. And today I have the honor of introducing Christina. Christina, beside being my mentor and my teacher, where I got my certifications from her academy, so it makes me an alumni from her school there. But she's also the founder of the Academy for Addiction and Mental Health. She has been a licensed psychotherapist for over 30 years, and she still provides online relapse prevention coaching and mental health nutrition. She also consults with supplement companies as well as IV detox program for residential addiction treatment and integrates them in a life-saving nutritional approach into the program. So she's an experienced public speaker, has presented to many conferences here in the country and maybe even overseas. I think she was in UK not too long ago, right, Christina? And she's also a former founding member and executive director of the Alliance for Addiction Solutions. Also, and very important thing to remember is that she will be giving a summit this spring, April 30th through May 2nd in Columbus area. So at this point, I don't want to take any more time from her valuable presentation. I'd like to introduce you, Christina.
Thank you so much, Salvatore. Thank you for having me here.
Thank you.
I'm always delighted to be a guest of the Alliance because it's close to my heart from when we founded it in 2007. And it was one of the organizations that helped get me to where I am here today. So I want to welcome everybody. Our topic today is the vital importance of dietary and supplemental protein in mental health and addiction recovery. The role of protein in our recovery is such an important, so close to my heart and such an important aspect, I believe, to recovery that a couple of years ago, I actually founded another nonprofit organization called Eating Protein Saves Lives, because I believe that it does. But before I get started, I want to ask everybody a question. So we're going to have a little bit of a discussion first. This is not just going to be me talking. This is also going to be us talking with each other. My question that I want to start us off with is, who has heard of post-acute withdrawal? Okay. Everybody, we're assuming, has heard of post-acute withdrawal. So what have you been taught causes it? And what have you been taught we're supposed to do about it? So those of you who can, please turn on your cameras so that we can see you all, so that we can really have a roundtable conversation about what we've all been taught about post-acute withdrawal. Who wants to start? Anyone?
Well, I can mention what we get taught in the recovery, like say 12-step arena and the rehab arena, which is generally never about keeping your blood sugar stable. That's for sure. It's like,
what are you taught? What are you taught about it, Elena?
Well, it's kind of a myth that refuses to die, like, which, from over 80 years ago, Bill W. I'm an active member, longtime member. That sugar, pop some sugar, and it's a good thing. That's a good thing.
That is a good thing.
Yeah.
Okay. Or at least we were taught that it was a good thing. I do not believe it's a good thing.
No.
Right. So, Terence Gorski, several decades ago, some of you may have heard of him, was a specialist in relapse prevention and wrote books on relapse prevention and had an institute, taught a lot of clinicians how to help prevent relapse in their clients and in their patients. And he's the person who coined the term post-acute withdrawal, or PAW. Right? We've all heard of pause. And what he taught, and what we've all been taught in the conventional treatment world, is that post-acute withdrawal is a major driver of cravings and relapse. It leads to feelings of anxiety, depression, irritability, insomnia. It pretty much happens to everybody. We pretty much can't do anything about it. We need to white knuckle our way through it. We can go to more meetings, we can pray more, or maybe we can go on psychotropic medication to reduce the anxiety, depression, and insomnia that comes from post-acute withdrawal. They're pretty much what everybody knows and has been taught. Do I have any amens?
Amen.
Okay.
Amen.
Thank you. Now, what a lot of people don't realize is that in their early days, Terence Gorski had a colleague, Merlene Miller. And Merlene Miller actually helped him write several of his books and worked very closely with him. However, after a while, she became very discouraged because she was highly trained and committed to the understanding that nutrition mattered to addiction recovery. And she kept trying to get him on board. And he refused. So they split ways. And he would talk about the psychosocial and spiritual components of recovery and relapse prevention. And she would talk about all of it. She and her husband, David Miller, actually did a lot of work with IV amino acid therapy back in the day. She's passed away now. Her husband, David Miller, wrote a book with Dr. Kenneth Blum on alcohol use disorder, ADHD, and reward deficiency syndrome. Very, very very useful book. And I mentioned this because what I'm going to be talking to you about today has actually been known for decades. It's just been refused by the conventional treatment world. And as a result, many people have died. And I think that that's tragic and possibly criminal because this is not new information. So post-acute withdrawal, what have we discovered from the nutritional side of things actually causes it? Well, there are two things, okay? Two factors. The first factor is very depleted neurotransmitter function. Now, we already know that depleted neurotransmitter function drives tolerance, right? The need for more and more drug to get the same effect because the brain has downregulated itself and simply can't keep up with the need for more and more neurotransmitter. And so our neurotransmitter stores get very depleted. So we go through acute withdrawal, and we all know what that's like. You know, the brain is saying, what are you doing to me? I can't function in the body. I can't function without the drug. Ouch. Right? People get through it by hook or by crook, but they're still depressed and they're still anxious and they're still exhausted and they're still craving and they still have trouble sleeping and they're still irritable and sometimes angry. Why? Because these neurotransmitters are still depleted. The reservoirs are still tiny and still empty. Early abstinence, early recovery, for those of you who haven't been there, is really stressful. We need all of our brain resources in order to cope with the stress of early recovery. Because you see, it's our brain's job to allow us to cope with stress gracefully. But to do that, it needs to be fed optimally. To do that, it needs to have all of the right neurochemicals in the right amounts, easily accessible. Well, in early recovery, they're just not there. Most people have not been eating very well. Most people have not been engaging in self-care. You know, we don't usually have good exercise in place or good sleep in place or all those wonderful things to make our, BDNF or, any of our neurotransmitters. And so people literally do not have the brain resources in order to step up and cope with the stress of early abstinence and early recovery. Well, what are the symptoms of depleted neurotransmitters? Depression, anxiety, insomnia, irritability, fatigue, and cravings. So it's kind of a no-brainer that people are going to have this experience post-acute withdrawal. Because it's a no-brainer, one would think that it would also be a no-brainer. The solution would also be a no-brainer. Okay, we have depleted neurotransmitters. What can we do to rebuild our neurotransmitters? What can we do to rebuild our brain function? Because you see, we've known for decades, many decades, the nutrients the brain needs to function optimally. Okay, this is not rocket science. Now, this may be brain science, but this is very basic brain science. The brain actually requires very specific amino acids on a daily basis to make its neurotransmitters and to do other things so that they get fired and utilized appropriately. The brain needs the right vitamins and minerals to make neurotransmitters out of amino acids. These include B6 and B12 and zinc and vitamin C and a few other things. Okay? And the brain needs the right fats in order to appropriately fire the neurotransmitters and for everything within the cell to work properly as well, because there's lots of tiny membranes within the cell as well. So this isn't just the big membrane outside the neuron leading to the synapse. These are also the little membranes inside, for instance, the one around the vesicles that are the reservoir that hold the neurotransmitter, okay? Those membranes have to be working optimally as well. Well, in very early recovery, most people do not have a brain that has the nutrient stores to be functioning at all. So what do we need to do? We need to be giving the brain that food immediately. Well, theoretically, we can get all that food, all of those nutrients from the food we eat. That should be the plan. That we're getting enough protein. I actually recommend a minimum of 20 grams of protein every 4 hours. In a while, I'll get to why I've come across that number. We need to be eating enough protein. We need to be eating enough fruits and vegetables for the vitamins and minerals, and some whole grains in there. And we need to be eating a variety of good, healthy fats. Now, some treatment programs do a wonderful job of providing those foods. We've got Ashley Jones here, who's the head nurse at Bridging the Gaps. And that is one program that's been doing this for a very, very long time. Portia Sarome has at times worked for Raleigh House of Hope in Denver, where they have impeccable food. And some of the rest of you may as well. So there's some programs doing this. Most programs don't. Most programs have very ultra highly processed foods, lots of sugar, and the food that they're feeding their people is very low in nutrient density. And they wonder why people have symptoms. We actually went into a program called Horizon Services in the San Francisco Bay Area about a year ago and helped them up their food program. They have a couple of detox units and a couple of longer recovery houses. And what they found is that once they got more protein in there and regularly throughout the day, staff-client interactions were smoother. Staff were less burned out. They didn't have to work as hard. Clients managed to stay past the first week, and they were able to engage more effectively in treatment because their brains were getting what they needed. Now, all of this is based upon the assumption that people can also optimally digest and absorb the food they're eating. And unfortunately, that's an assumption that doesn't always play out, especially with people who've been drinking very heavily for years or decades. People who've been using methamphetamine as well have really destroyed their entire digestive tract. And so it actually takes a while on good food to heal the digestive tract, to be making enough enzymes from hydrochloric acid in the stomach to digestive enzymes from the pancreas to in the small intestine to absorb the rest of the nutrients. There's a lot of inflammation in the gut. So sometimes, even though people are eating really well the first month or so, they're not necessarily absorbing all the nutrients. This is a little aside. This isn't directly about protein, but this is sometimes why we need to bring in supplemental nutrients and supplemental amino acids and protein itself, just to help jumpstart the system. You know, in order to digest protein, and especially if people have been moving from not eating protein to eating protein, their stomach is not always up to the task and is not always making enough hydrochloric acid. Hydrochloric acid is the first step in breaking down protein. We actually need to have an acidic enough stomach to make this happen and to make the rest of digestion happen. Symptoms of not enough hydrochloric acid in the stomach can include gas and bloating, getting full really easily, just like not eating protein. It just sort of sits there and saying, I don't want to eat that. That doesn't make me feel very good. Well, sure, you're not digesting it. So sometimes we need to bring in digestive enzymes. Hydrochloric acid, pancreatic enzymes, a combination. Each patient is a little different, but generally bringing in this support makes a huge difference. And Joan Matthew Larson, in her wonderful book, 7 Weeks to Sobriety, that she published in 1993, digestive enzymes are part of her detox and maintenance protocol, specifically for that reason, so that people are more able to extract nutrients from the food they're eating. But in the meantime, let's bring in a multivitamin with the cofactors to help turn the amino acids from the digested protein into neurotransmitters. Let's bring in some fish oil to make sure we have enough omega-3s. Let's bring in supplemental protein, like in the form of protein shakes, but also in the form of free-form amino acids. So we can get full spectrum free-form amino acids in powder or capsules. I know Portia here has a favorite, and that is Perfect Aminos by Body Health. And what these free-form amino acids do is they go everywhere in the body doing all sorts of the things we need them to do, make our skin, make our muscle, make our digestive enzymes, make our blood cells, right? Even make our DNA. But if we're getting the supplemental amino acids in this form, they don't need to be digested. They're easily absorbable, and there's enough left over to get to the brain and be the precursor for our all-important neurotransmitters. And in fact, we found that very often these amino acids get to the brain within 20 minutes and can start rebuilding these neurotransmitter systems within 20 minutes. And this is why we use targeted amino acids. Who here uses targeted amino acids? Okay, because they are so incredibly powerful in turning off the symptoms of post-acute withdrawal within 20 minutes. I tell people I can turn off a craving, a full-blown physical craving, within 20 minutes using either food or one of these specific amino acids. This would be a game changer in the treatment world if it was widely utilized. Those of you who work in treatment programs that use amino acids, you've seen the miracles, right up front that come from using amino acids. And so we will assess using a wonderful tool created by Julia Ross. We call it the amino acid therapy chart that identifies depleted neurotransmitter systems. The problem with the tool is that people who've been eating crap food, low nutrient dense food for a long period of time, and are poly drug users, all their neurotransmitter systems are very, very depleted. This is where we just want to get people eating and where we want to be using the full spectrum free-form amino acids for a week or two just to rebuild the system. However, if there are specific symptoms that are causing people distress and cravings, such as worry or anxiety or so tired you fall asleep in group, or so awake at night you can't get to sleep, and then you fall asleep in group the next day, we want to use the targeted amino acids in order to, within 20 minutes, start rebuilding the specific neurotransmitter systems whose depletion are causing specific post-acute withdrawal symptoms in clients. And so, for instance, we'll use tyrosine to quickly start rebuilding dopamine and norepinephrine to give energy and drive and motivation and stay awake in group. That matters, right? We will use 5-HTP to help reduce cravings that come from worry and agitation and anxiety and being so afraid of what somebody's going to think of me that I'm just going to sit in the corner in the group and I'm not going to open my mouth. And if the counselor calls on me, I'm just going to sort of stammer and not say anything. Okay? How many of you have had clients who were just simply too shy to participate in group process? We all have. So the 5-HTP, if somebody's not on, if we can get to them before they get on a SSRI, significantly changes people's ability to function in group. Again, this matters. We can use GABA and theanine and tryptophan to help people sleep at night, because insomnia is a huge trigger for cause of addiction in the first place and a huge relapse trigger for people in recovery. So we can use amino acids to address all of these issues. And so this is where getting in enough protein and supplementing it with the free-form amino acids in full spectrum form and targeted makes a huge difference. Now, I'm going to be talking about blood sugar in a minute and why we need to be spreading our protein out throughout the day. There's a number of different recommendations out there for the amount of protein most adults require throughout the day. The minimum appears to be, and I do say minimum, 60 to 80 grams of protein for men and 40 to 60 grams of protein per day for women. This breaks down into 15 grams. If we're going to spread it out throughout the day, we would say 15 to 20 grams of protein every 4 hours. Now, many people find that they do much better on a significantly higher dose than even 80 grams of protein a day. That moving up to 100 to 200 grams of protein a day is optimal. And I think that for many people, maybe even most people, that's true. However, you got to meet people where they are. And I had a practice for 20 years in Denver with the chronic relapser. I asked all the treatment providers in Denver to send me their treatment failures, to send me the people who just were going round and round and round. They weren't giving up. They kept on trying, but they kept on missing the mark. So I had a 20-year practice working with these people. Committed, dedicated, desperate, deeply ashamed, and deeply hopeless. Now, all of my clients had several different reasons as to why they kept relapsing. And so we had to identify them and work on them. Sometimes it was untreated trauma. Sometimes it was lack of your basic resources. Sometimes it was lack of a sober community. But almost always the one thing everybody had in common is that they were eating probably less than 10 grams of protein a day. My chronic relapsers were just not eating. They didn't have eating disorders. They just couldn't be bothered. They were hungry. They would go reach for, some potato chips or 3 cups of coffee with sugar or a donut or, occasionally real food, but very sporadic. And when I would ask people, when was the last time you ate protein prior to your slip or your craving or your domestic violence incident? They would look at me blankly and they would say, okay, it's 4 o'clock in the afternoon. They would say, I had an egg at 7 o'clock this morning. Well, what else have you eaten today? Nothing. Okay. So they had exactly 7 grams of protein all day. And then they wonder why they're feeling foggy and miserable and anxious and craving. So what I found is getting those people just eating 20 grams of protein every 4 hours makes a tremendous difference it's a game changer for these individuals because all of a sudden they feel stable. They feel grounded. They feel clear. They're no longer craving. They have energy. They can function. And they can stay abstinent and actually fully engage in the recovery process. So I'm going to be talking about blood sugar and why we want to be spacing this out throughout the day in a minute. But before I do that, any questions, comments, or stories? I bet some of you have stories.
Hi, I have a question. My name is Nita, and I had a client who has a big issue with digesting protein,
Mhm.
especially when they're just having just like plain protein, like probably grilled chicken or grilled fish, or even we tried to introduce quinoa too, but it would be the same problem that they would get highly constipated.
Mhm.
Also introduced the HCl, but it's not really helping that much. So what would be your suggestion, and what is the cause of it? I know the HCl, of course, the low acidity and all that stuff. So
So what dose of the HCO are you using?
um, I don't remember. I've just kind of like brought this up
Yeah, well,
right
because
now, but I don't remember that.
sometimes when the right nutrient isn't working, it's just because we're dosing it too low. Hydrochloric acid generally comes in capsules that are around 240 milligrams or just around 600 milligrams. And I know people who need a couple of the 600 milligram capsules in order to adequately digest their protein because initially they're not making any at all. And so there's something called the hydrochloric acid challenge where you keep increasing your dose of it until you feel a warmth in your tummy or a little bit of burning. And that's a sign that, okay, now you're taking though too much. Let's cut down by 1 or 2 pills. And now we're copacetic. So making sure people are actually getting the effective dose of HCl really, really matters. But it's not just HCl, we also need the other digestive enzymes. So bringing in a good full spectrum pancreatic enzyme for a while as well, make sure that everything's working properly. As to why hydrochloric acid production requires a number of different nutrients. The less protein we eat, the less apparently hydrochloric acid we can make, and we do make. But the other issue is a disorder called pyroluria. Pyroluria was first identified by the orthomolecular psychiatrists in the 1950s, Dr. Abram Hoffer and Dr. Carl Pfeiffer, who discovered something called the MOVE factor. And this is people with schizophrenia would often have kind of purplish urine. And so they started studying the chemical composition of this purple urine, sort of mauve colored, right? And they called it the MOVE factor and discovered that these people had very high levels of a chemical called cryptopyrrole. And Merry Christmas, Tyra, and hopefully you can listen to the whole lecture by recording. Merry Christmas. They did more research and discovered that up to 30% of people with alcohol use disorder, and this is probably true for other addictive disorders as well, actually have this genetic disorder called pyroluria, which dramatically depletes the body of zinc and B6. Well, zinc and B6 have a number of roles in the body, including making hydrochloric acid. but also making GABA and serotonin. So if we have pyroluria or pyrrole disorder, we will often have a lifetime social anxiety and anxiety disorder because we're not making enough serotonin and we're not making enough GABA. We're probably also not sleeping very well because we're not making enough serotonin and melatonin and GABA. But the other thing that people with pyroluria don't do very well is digest protein. A lot of people, some of the diagnostic criteria, in fact, are I don't like meat. It kind of makes me feel heavy and yucky. I prefer to be a vegan. I prefer to be vegetarian because their bodies can't make enough hydrochloric acid without this zinc and B6. So they come into treatment and we start throwing all this protein at them and they're saying, no, no, no. They're also not sleeping and they're anxious and they're irritable and they're shy. So once we identify it, bring in enough zinc and B6 to turn this around and supplement with enough hydrochloric acid for a while, these people all of a sudden start developing a taste for meat because they can now digest it. Does that help answer your question, Nita?
Yes, thank you so much. My other part, when you just talked about zinc and all, I have even tried to give zinc. This person is just very sensitive and reacts to a lot of different herbs or medications and all. And zinc also creates that problem for that person.
So you can change the brand and you can use tiny little bits of zinc dosed throughout the day to see if you can just kind of creep in under that threshold.
Yeah, for digestive enzymes, I've always used Designs for Health quite a bit, and because they are a pretty good brand, I like them. And zinc, I've tried to give because this person is so sensitive, and so I have tried to give it in liquid form.
Mm-hmm. And can they tolerate maybe a drop of zinc several times a day throughout the day?
Yeah, they stop taking it. That's the whole problem. That after when they say, "Oh no, I'm still getting heavily constipated and all that stuff with this," and then they just stop. So
Yeah.
should I
Well,
try
this
it
is
again? I mean, you know,
tricky.
it's just kind of like very concerning, especially when you have that type of gut issue going on.
Well, it really is. And sometimes there's no easy answer. Sometimes you do what you can do, but you see, Nita, this is where the free form amino acids like the perfect aminos can be a game changer because they don't need to be digested.
So Perfect Aminos, which was the brand that you said? Was it Body Health? Or
It
is
was
there any
Body
other
Health.
brand?
There are other brands out there as well. You
Okay.
know, good quality, full spectrum amino acids. I'm sure that Designs for Health has one.
Okay.
And that bypasses the need for digestion. It bypasses the need for hydrochloric acid. You can dose it throughout the day. And gradually, just the extra amino acids themselves will help the body start producing more hydrochloric acid and will start kind of rebuilding the whole digestive system. You know, there may be other issues going on as well. This is where you may need to bring in your probiotics, your fermented foods. You know, we don't believe in just, you know, one answer. Usually, you're right. Usually, it's a multifaceted answer, and some of these complex clients can be very, very, very complex.
Yes.
And after I talk about blood sugar issues, I'm going to open it up to the whole room to see what suggestions other people may have, because we've got some pretty amazing clinicians in this room, and I certainly don't have all the answers. But these are all good things to be thinking about. Thank you. All right.
I appreciate it. Thank you so much.
Low blood sugar. The second cause that we have discovered in clinical practice for post-acute withdrawal and all of its symptoms is low blood sugar, sometimes due from what we're going to call reactive hypoglycemia, and sometimes due from just not eating. So again, as I shared with you, so many of my chronic relapsing clients, when I ask them what they ate per day, they're eating once a day at dinner time after their cravings have already become intolerable. We have found that eating 20 grams of protein every 4 hours keeps blood sugar nice and stable, and therefore allows people to retain access to their recovery skills. Now, we can talk about intermittent fasting, we can talk about keto, and all of those kind of require a separate conversation. But for most people, most of the time, eating a minimum of 20 grams of protein within an hour or two of getting up and then consistently throughout the day does a number of different things. Because let's look at what happens when blood sugar drops. Now, blood sugar can drop very low due to two things. One, simply not eating. And secondly, through eating very high sugar or high simple carbohydrate foods that jack your blood sugar up very quickly. Now, when we have studied people in early recovery, when we've done a 5-hour glucose tolerance test, thank you, Portia, for your comment on amino acids. What we have found is that up to 95% of people with all addictive disorders in early recovery are medically diagnosable with reactive hypoglycemia. What does that mean? That means that within half an hour of eating sugar, blood sugar spikes up to diabetic levels, hangs there for maybe half hour, and then the brain says, oh no, blood sugar way too high, and the pancreas, which is being sluggish by now, overproduces insulin. Blood sugar plummets low to actually dangerous levels. So reactive hypoglycemia is diagnosed pretty much by how low blood sugar plummets after a sugar load. What happens next is that blood sugar levels rise. And they rise because the brain says blood sugar way too low, we could go into a coma, we could die, do something. And now the adrenals kick in, and the adrenals release adrenaline back into the bloodstream. Or into the bloodstream. And adrenaline signals the release of glucagon, or stored sugar, back into the bloodstream. So blood sugars can slowly come back up to normal, which is a good thing. The bad thing is what adrenaline does. So what we have noticed when blood sugar drops very low, first of all, is that willpower goes out the window. It has been discovered that the brain actually needs significant fuel, in this case, glucose supply, for willpower to function. Blood sugar drops, willpower goes out the window. What do we mean by willpower? The ability to say no and the motivation to say no. Why we're saying no to something that we're actually wanting at the moment. That's the first thing that happens. Second thing that happens is that after adrenaline kicks in, adrenaline destabilizes us, right? It makes us reactive. It could make us shaky. It can make us angry or irritable. It can make us anxious. But it destabilizes us. Anybody with an substance use disorder or even a process addiction has a sensitization that has occurred in the brain to stress. Stress itself, this destabilization, triggers a craving in the brain. This is a conditioned response. This is completely outside of our control. It happens. And it can take many years actually for this to get extinguished. So we get a craving for our drug of choice. Could be sugar, could be alcohol, could be cocaine, could be whatever, right? Could be pornography, could be gambling. We get a craving. But the other thing that adrenaline does is it puts the prefrontal cortex offline. Now, what's significant about that is this is where executive functioning lives. This is where we store and access our recovery skills. Our ability to pause, our ability to, quote, think the drink through, our ability to do anything other than pick up has gone on vacation. So we miss a meal and blood sugar drops too low, or we eat a high sugar meal and blood sugar first spikes and then plummets. Willpower goes out the window. Adrenaline kicks in. We get a craving from this conditioned response, but we have no willpower and we have no access to our recovery skills. What tends to happen? People tend to topple over. And if they don't, they're white knuckling it, they're in distress, they're miserable, and they're not paying a whole lot of attention to what you're trying to teach them in treatment. So we want the protein to be spaced out throughout the day. We do not believe in intermittent fasting in early recovery because we have found that that has set people up for failure. We will use the amino acid L-glutamine to feed the prefrontal cortex. If food is not readily available, if you've gone too long without food and these issues start, creeping in. And then sufficient protein throughout the day to turn into the amino acids along with supplemental protein to rebuild neurotransmitter levels. So people in early recovery, early abstinence, who are doing all of that, who are keeping blood sugar stable, eating regularly, getting enough protein, getting enough cofactors, digesting it, bringing in supplemental nutrients as needed, all of a sudden their post-acute withdrawal doesn't exist anymore. I have worked in treatment programs, residential programs, and those of you who have know exactly what I'm talking about. Most people are brain dead for the first 2 or 3 weeks. Most people are brain dead. But if among, if you have some people among this group who are actually doing what I'm recommending and taking extra amino acids and, you see this tremendous difference between them and the people who aren't. The people who are getting what they need for their brains to function, by the end of the first week, they're actually functioning. Their mood is a lot more stable. They're sleeping more deeply. They're not having cravings. They're able to function in treatment. They're able to do the doing of recovery. Whereas the people who aren't stay brain dead for a very, very, very long time and often don't make it. So we've got 10 minutes. Questions, comments, stories? Who would like to share?
Hello, everybody. Hi, Christina. Well, I'll just say real quick that I am a graduate of Christina's level 1 um, amino acid therapy course a couple of years ago, and it's truly a game changer, really and truly. So I just wanted to throw that in there.
Thank you, Elena. Yes, because at the end of level 1, I make you an expert, at least I try to make you an expert at amino acid and nutrient therapy and the use of diet for mental health and addiction recovery. I'll talk briefly about the upcoming conference that Salvatore mentioned called, I don't know, something like powerful nutritional strategies for effective addiction treatment and sustained recovery. This will be in Columbus, Ohio for 3 days at the beginning of May. And you will, in these notes, you will have access to the website for the conference, but you can also access it through the Academy website. And we have brought together an amazing array of speakers to talk about all aspects of nutrition and addiction treatment and recovery. This is the first time a conference like this has happened since 2010. And it's going to be very exciting to have us all under the same roof, sharing stories, talking with each other, learning from each other, and proclaiming to the world how powerful this is. So I hope to see all of you there. We do have an early bird special going on right now that will be ending on January 15th. So now is the time to buy your tickets. Okay, I'm going to call on some people because I'm just like that. Portia, what has been your experience in using this approach in treatment programs? Portia was the nutritionist at Raleigh House of Hope in Denver for several years.
Okay, I'm driving, so I'm pulling over.
Oh, sorry about that, Portia.
I actually give me 5 minutes. Ask another question
Okay.
first, and I gotta find a safe place to pull over.
Okay, I'll give you 5 minutes.
Sorry.
Salvatore. I know Salvatore is not driving.
No, I'm not driving. And first of all, I wanted to thank you, Christina, for today, for your level 1 and level 2 classes that I ended up attending and graduating from the academy. And like I said at the beginning of our conference here, or the forum, I met Christina probably about 7 years ago in Salt Lake City. And since then, I've incorporated the program with my addiction recovery in Youngstown. I know the 2 ladies that were here before, they both had to go, unfortunately. But talking about the difference with the amino, we were doing a trialing, and Tyra was actually there present when we had a gentleman that just could not keep his eyes open during our IOP class. And he was just tired. So we start trialing with tyrosine. And if Tyra was here, she would have mentioned, because she saw the change within 10 minutes and could not believe how this guy came alive just within 10, 15 minutes from being sleepy and lethargic, just not being able to participate, into just coming right out and being animated again. So I will tell you, and that's just one of the instances. We can go on and on, but one of the first thing that I do is I let them do the amino acid therapy chart from Julia Ross that Christina also mentioned. And from there, when I'm there, I can see already what we need to work on it at that particular day, at that particular time. So that's one of the many tools.
Yeah, it's really exciting to run across treatment programs like yours, Salvatore, that's actually implementing these amazing tools, because it just changes the trajectory of people's recovery journey.
Absolutely, absolutely. And along with that, Christina was also mentioning the probiotics, digestive enzyme. Those are almost my go-to 99.9% of the time. Get them on a good probiotics, get them on a good digestive enzyme with HCl, and you can see the difference.
Yeah, yeah. And they're grateful. People are grateful.
Yeah,
because they feel
absolutely.
better.
Yeah.
Yeah.
So yes, thank you again.
You are welcome. Any other quick stories or comments? Or
Christina,
questions?
I'll share. This is Portia. If you want,
Yes.
if they have a minute, I can share. I just wanted to share. I'm sorry, I'm pulled over, so I don't have my video on, but I've known Christina for 20 plus years. It's been a while. And I did take one of her first certification classes, and I agree with, I think it was Elaine, that it's a game-changing class in terms of if you're working with mental health and or addiction clients. It's really a non-negotiable to know this information and to implement the information. But my experience, I worked for almost 10 years in an inpatient treatment center and outside of Denver called Raleigh House of Hope, which is still there. I'm just not with them anymore. But the thing that I noticed when people would come into inpatient treatment is that when they were fed protein, because we did have quite high level nutrient dense foods, and protein was something that we focused on, and some of that was my doing. But when they got the amount of protein in they needed, and the subsequent fats and fruits and vegetables, complex carbohydrates, but especially the protein, these people that, as Christina said, were kind of brain dead initially coming in, just lit up. I mean, just the protein alone makes such a difference, and I think Christina probably taught me this, but I always feed my clients, if they're newer clients and they haven't been doing protein, and then in session they're brighter and more attentive and more alert. And the amino acids notwithstanding, I mean, they're very, very, very important, those targeted amino acids, but protein alone just can make all the difference in someone's experience of therapy and recovery.
Thank
And
you,
I saw it
Portia.
firsthand. Yeah, you're welcome.
Yeah, I'm glad you brought up feeding people in session, because I can have clients who are just bouncing off the walls, not able to settle into the therapy session, very labile, and you feed them in session, and 20 minutes later, their entire ability to process has changed. Jen, did you have a question?
No, I did not.
Okay. Yeah, people's ability to function in a therapeutic session completely changes once they have a well-fed brain. Well, I want to thank you all for coming. And Salvatore, I want to thank you and the Alliance for Addiction Solutions for having me.
Thank you, Christina. Thank you. It's been a pleasure and always very educational. Thank you.
And hopefully I'll see all of you in May in Columbus, Ohio, or online. Bye-bye.
Thank
Thank you.
you.
Bye-bye.
All right. Bye-bye.
Bye-bye.